there, I'm Dr. Matthew Schulman, board certified plastic surgeon, and welcome to another episode of Ask Dr. Schulman. Today's question is, can I use my own fat in my breast to replace the need for a breast implant? That question makes a lot of sense because, as you know, we commonly take fat from the areas you don't want it and put it in areas you do want it, like your butt or your hips. So why can't we use it in your breast? You can. So that procedure will work, but there's some very specific situations where I think fat transfer to the breast will give you the look that you want. So let's talk about that a little bit. First thing to keep in mind is what a breast implant is. So this is a breast implant. This is a shell that's filled with a silicone gel. So this implant, when it's put inside your breast, will give you some roundness and some fullness. And also, because it has this nice structure to it, it's gonna give you a round, youthful shape to your breast. So it's gonna give you some cleavage, it's gonna give you some of that under boob that people like. It just gives a more lifted, youthful look. The reason that this implant is able to do that is because it's structured. The stuff that's inside, the silicone, is within a shell, so it has this shape to it. If I put fat into your breast, it will make your breast larger, but it's not going to give it the structured look that an implant will. So it might make your breast look larger, you might feel fuller, but it's not going to look like a breast implant. It's not going to look lifted and rounder. So if that's the type of look that you're going for, then you're better off going with a breast implant instead of using fat. If you try to achieve that look with a fat transfer, I think you're going to be disappointed. There are some situations where I think that fat transfer to the breast is a really, really good idea. The first thing is if you have a breast asymmetry. So let's just say, for example, one breast is significantly larger than the other breast. If I put an implant in the smaller breast to make the size equal, your size might be equal inside of a bra or under clothing, but without clothes on, the smaller breast is going to look like it has an implant, which is going to make it look very different than the other breast, which doesn't have an implant. So you can actually get significant asymmetries and worsening of your asymmetries if you just put an implant in one breast. That's a situation where fat would work really well. Let's just put fat in the smaller breast to make it larger and make it look like the other breast. The other situation is if someone has a breast deformity. For example, if you've had a previous surgery and there's an indentation or a scar, or you're a woman that had a lumpectomy for removal of a suspicious lesion or even a breast cancer, if you're left with a defect or a divot, the best way to fill that in is using your own fat. So that's a situation where it's really good to take your fat from wherever you don't want it, like your stomach or your flanks, and we can add that fat into that defect on the breast and make things look more symmetric. The third situation where I think fat transfer to the breast works really well is in combination with an implant. So let's imagine that I put this breast implant in a woman and she's very thin. And no matter how good the implant is, you still may see the edge of the implant, you may see some ripples, it may feel like an implant. So in that situation, we may take a little bit of fat and put fat around the implant along the edge to help camouflage it so that the implant's more hidden beneath that extra layer of fat. Sometimes women have had implants years ago and they come back and they're unhappy with things like visibility or palpability or rippling. They might be a good candidate to have some fat taken and put around the implant instead of going through a much more significant procedure, which would involve removing the whole implant and maybe putting in a new implant with some more complex maneuvers on the inside. So fat transfer to the breast works really well, but in very specific situations. If you're wondering if this is a procedure for you, go see a board certified plastic surgeon who has experience with both breast implant surgery and fat transfer to the breast. That way he or she can give you a good idea of which would give you the look that you're going for. As always, I hope you enjoy this video. This is part of our Ask Dr. Schulman segment. If you liked it, make sure to click like so that I know you liked it. If you have any questions or comments about the video, put it down below and I'll make sure to answer it. And also make sure to subscribe to this YouTube channel. That way you get notified whenever I add new videos like this. Thanks again for watching, and I'll catch you on the next video of Ask Dr. Schulman.